something inside your body has stopped moving. And every hour you wait, it's getting harder, drier, and more dangerous. You keep going back to the bathroom thinking this time something will happen, but the pressure only gets worse. Your body keeps straining against something it can no longer push out. And the terrifying part is, most people don't realize they've crossed into a medical emergency until the symptoms start spreading far beyond the intestines. If you're serious about taking better care of your health, make sure you subscribe. I share simple, practical advice designed especially for seniors. And feel free to leave a comment telling me where you're watching from. I appreciate every one of you. Let's get back to it. Something is wrong inside your body right now. Not sharp pain. Not the kind of symptom that sends people rushing to the emergency room. Just a pressure, deep, low, and stubborn, that has been sitting in your lower belly for longer than you want to admit. You've been to the bathroom, you've tried, but every single time you sit down, nothing happens. Just that tight, swollen heaviness that makes even the simple act of sitting in a chair feel uncomfortable. At first, you told yourself it would pass. You drank a little more water. You walked around. You waited. But that pressure didn't go anywhere. And now, you're back in that bathroom again. Your body sending the clearest signal it knows how to send. And still, nothing comes out. The effort is there. The urge is there. But the release never comes. And at some point, between the third and the fourth failed attempt, you stopped calling this normal constipation. Because this doesn't feel like constipation anymore, something is stuck. And somewhere in the back of your mind, that thought has been growing louder every hour that passes. Here's what I need you to understand right now, before anything else. This is not as rare as you think. Fecal impaction, stool that becomes so hardened and compacted inside the rectum that the body can no longer move it on its own, affects millions of people every single year. Research in gastroenterology consistently shows that the longer stool remains inside the colon, the more water the colon draws out of it. What starts as a soft, manageable mass gradually becomes dense, dry, and immovable. The body keeps trying. The muscles keep contracting. But the blockage doesn't budge. And here's the part most people don't find out until it's too late. This condition escalates faster than most people expect. What feels like a bad few days of constipation can quietly cross a line into something that requires emergency medical treatment. And the instinctive things people do when they feel stuck, pushing harder, taking stronger laxatives, or doing nothing at all out of embarrassment, often make the situation significantly worse. I'm Dr. James Cross, and in this video, I'm going to walk you through exactly what is happening inside your body right now. The hidden symptoms that tell you this has gone beyond simple constipation, the dangerous mistakes you need to stop making immediately, and the safest steps you can take before this becomes a medical emergency. But before we go any further, subscribe to this channel right now. Because one day, someone sitting exactly where you are today will be too frightened and too embarrassed to tell anyone what they're going through. And this video might be the only thing that reaches them in time. Let's start with what's actually happening inside your body, and why this is no longer something you can wait out. Your body has not stopped working. That is the first thing I need you to understand, because most people sitting in your position right now have already started to believe the worst. They think their digestive system has simply shut down, that something inside them has broken, that their body has given up. It hasn't. Right now, deep inside your lower abdomen, your rectal muscles are still contracting. They are still squeezing, still firing signals to your brain, still doing everything they were designed to do. The system has not failed. The system is trapped. And there is a critical difference between those two things, because one of them has a solution. And once you understand what's actually happening in there, the path forward becomes much clearer. Here is what your digestive system does every single day, without you thinking about it. As food moves through your intestines, your colon extracts water from waste material continuously. That is its job. Under normal circumstances, this process produces stool that is soft enough to pass through the rectum without effort. But when stool slows down, when it stays inside the colon longer than it should, that water extraction doesn't stop. It keeps going, and the longer that stool sits, the drier, denser, and harder it becomes. A 2010 study published in gastroenterology literature confirmed that prolonged colonic transit time directly correlates with increased stool hardness and reduced moisture content. In simple terms, time is what turns a manageable situation into an immovable one. Think of it this way. Fresh concrete poured into a narrow tunnel is workable. It can be shaped, moved, redirected. But leave that concrete sitting inside that tunnel long enough, and it sets. It hardens against the walls. And now, no amount of pushing from one end is going to move it through the other. That is what has happened inside your rectum. And here is what makes this particularly brutal. Your body still doesn't know the stool has become unmovable. Your rectal muscles are still receiving the signal to push. They are still contracting against that hardened mass repeatedly, rhythmically, automatically. Every failed attempt is your body doing exactly what it was built to do. It is not failure. It is your digestive system working at full effort against an obstacle it was never designed to handle alone. Which brings us to the thing that surprises most people when they first hear it. Straining harder does not help. It actually compresses the stool tighter against the rectal walls, increases swelling in the surrounding tissue, and makes the blockage more difficult, not less difficult, to clear. Your effort is real, but the direction of that effort matters enormously. And what you do in the next few hours will determine whether this resolves safely at home or becomes something far more serious. Because the warning signs most people miss completely, they are already showing up. You just don't know what to look for yet. Here is where it gets complicated, because fecal impaction does not always announce itself the way people expect. Most people assume the only symptom is the inability to go. They assume they will feel it exactly where the problem is, in the abdomen, in the bowel, in the lower belly. And they keep waiting for some obvious, unmistakable signal that tells them things have crossed a line. But the body doesn't work that way. The symptoms that show up first are often the ones that confuse people the most. And because they don't immediately connect those symptoms to what's happening in their rectum, they ignore them. They treat them separately. They assume something else is wrong entirely. And that delay, that window of misunderstanding, is exactly where this condition gets the opportunity to become dangerous. The first thing that catches people completely off guard is liquid. You've been unable to pass anything solid for days, and then suddenly, without warning, watery fluid begins leaking out. And your first instinct is relief. You think the blockage is clearing. You think your body has finally found a way through. But what is actually happening is one of the most deceptive mechanics in the entire digestive system. Liquid waste from higher up in the colon is finding the only path available to it, seeping around the hardened mass and passing through. The obstruction is still fully intact. Nothing has cleared. The leak is not a solution. It is a sign that the situation has worsened. Doctors refer to this as overflow or paradoxical diarrhea. And emergency physicians see patients misread this signal every single day. The second symptom is one almost nobody connects to constipation at all: bladder problems, difficulty urinating, a weak, slow urine stream, a constant urge to go with very little result. These are not unrelated issues. The rectum sits in an extremely tight anatomical space inside the pelvis, sharing that space closely with the bladder and a dense network of surrounding nerves. When the rectum becomes severely distended with hardened stool, it begins pressing directly against the bladder wall. Research in pelvic floor medicine has documented this mechanical compression effect in patients with severe fecal impaction, and the result is a bladder that cannot fill or empty properly. If you have been struggling to urinate alongside your inability to pass stool, that is not a coincidence. The third symptom is pain appearing in places that seem completely unrelated: lower back, tailbone, pelvis, upper thighs. Some people even feel a dull, persistent ache radiating down through the legs. Because the rectum does not sit in isolation, it is surrounded by nerves that branch outward in multiple directions. When that rectal space becomes inflamed and pressurized, those surrounding nerves respond. The pain travels, and people spend days treating their back or their pelvis without ever identifying the actual source. A 2018 review in the Journal of Pain Research confirmed that referred pelvic pain, pain felt at a distance from its true origin, is a well-documented neurological phenomenon in patients with lower gastrointestinal obstruction. Your body has been sending signals this entire time. You just didn't have the translation. And now that you do, now that you understand what these symptoms actually mean, you need to hear about the mistakes that are actively making every single one of them worse. The moment people realize something is seriously wrong, they act. And almost every instinct they follow makes the situation worse. This is not a criticism. These are completely understandable responses to a frightening physical experience. But understanding why these instincts backfire is the difference between resolving this at home and ending up in an emergency room. So, before we talk about what you should do, we need to talk honestly about what most people do. Because there is a very real chance you have already done some of these things in the last few days. The first and most common mistake is straining harder. It feels logical. Your body needs to release something, so you push with everything you have. But here is what that pressure is actually doing inside your body. Every time you bear down forcefully against hardened, immovable stool, you are compressing that mass tighter against the rectal walls. You are increasing inflammation in the surrounding tissue. You are swelling the very muscles that need to relax in order for anything to pass. A study published in the journal Diseases of the Colon and Rectum found that chronic excessive straining is directly linked to pelvic floor dysfunction, rectal nerve damage, and in severe cases, partial rectal prolapse. You are not pushing the blockage out. You are building a tighter seal around it. The second mistake is ignoring the early urge. Many people, out of embarrassment or inconvenience, suppress the urge to go when it first appears. They tell themselves they will go later. They hold it at work, hold it while traveling, hold it through social situations. And each time they do, the colon continues extracting water from that stool. What was manageable yesterday becomes significantly harder today. Research consistently shows that delayed defecation response directly accelerates stool hardening, making impaction not just more likely, but more severe. The third mistake is reaching for the strongest laxative available. It feels like the obvious solution, but stimulant laxatives, the harsh, fast-acting kind, force the colon into aggressive contractions against a blockage that cannot move. The result is cramping, pain, and in some cases, increased pressure against already inflamed tissue. Long-term, repeated use of stimulant laxatives rewires the bowel's natural rhythm, creating a dependency that makes spontaneous bowel function increasingly difficult without chemical assistance. The fourth mistake is stopping food and water entirely. When the abdomen feels swollen and nothing is moving, eating feels counterintuitive. So people stop. They avoid food. They reduce fluids. But dehydration is one of the primary drivers of stool hardening. Reducing fluid intake during an active impaction removes the body's only natural softening mechanism. It doesn't slow the problem down, it accelerates it. And underneath all of these physical mistakes runs something nobody talks about: the psychological weight of this experience, the anxiety of repeated failure in the bathroom, the disrupted sleep, the fear of eating, the isolation of suffering through something too embarrassing to mention to anyone. That psychological pressure is real, and it matters medically, because stress and anxiety directly suppress the parasympathetic nervous system's signals that regulate healthy bowel function. Your body needs calm to move, and right now, everything around this situation is working against that calm, which is exactly why the next stage, when the body begins losing its ability to compensate entirely, happens faster than most people realize. There is a point in this process where the body stops compensating, not gradually, not with a clear warning, just a shift, subtle at first, then impossible to ignore, where the symptoms that were uncomfortable yesterday become something your body can no longer manage on its own. And the people who miss that shift are the ones who end up in the most serious trouble. You need to know exactly what that shift looks like. Up until this point, your body has been working around the blockage, diverting, adjusting, sending signals that something is wrong while still maintaining basic function. But hardened stool that remains trapped in the rectum long enough begins doing something far more dangerous than causing discomfort. It begins putting sustained mechanical pressure on the surrounding tissue. And tissue under that kind of prolonged pressure does not hold indefinitely. The first signs that the body is losing its ability to compensate are easy to dismiss individually. Nausea that comes and goes. A bloating so severe that the abdomen feels visibly distended. The complete inability to pass gas. Not reduced, but completely absent. Exhaustion that feels disproportionate to what is happening. Cold sweats during bathroom attempts. A growing sense, difficult to articulate, that something inside is under a pressure it was never built to sustain. If you are experiencing any combination of those symptoms right now, this has moved beyond a home management situation. Here is why. When the rectum remains severely impacted and distended over an extended period, blood flow to the rectal tissue begins to reduce. Reduced blood flow means reduced oxygen delivery to that tissue, and tissue deprived of adequate oxygen begins to break down. In advanced cases, this breakdown creates the conditions for something gastroenterologists classify as stercoral perforation, a rupture of the bowel wall caused by pressure necrosis from hardened stool. A 2014 review published in the World Journal of Gastroenterology identified stercoral perforation as carrying a mortality rate of up to 35% in cases that reach surgical intervention late. This is not a statistic designed to frighten you unnecessarily. It is a statistic designed to make the timeline very clear. This condition has a window, and that window is not as wide as most people assume. Elderly patients, individuals with chronic constipation histories, and those with reduced bowel motility face a significantly narrower window than younger, otherwise healthy adults. But no age group is exempt from the escalation pattern once impaction reaches this stage. Dr. James Cross wants you to hear this next line clearly. At this stage, the goal is no longer forcing it out. The goal is preventing damage. The conversation has changed. The approach has to change with it. Because what worked, or what you hoped would work, in the first 24 hours is not what this situation requires now. The body is telling you it needs intervention, not willpower, not another bathroom attempt, not another glass of water and a wait-and-see approach. It needs a plan, a specific medically grounded step-by-step plan. And that is exactly what comes next. Stop straining. That is the first instruction. Not a suggestion, not a gentle recommendation. A direct medical directive. Because everything that follows depends on your body being given the chance to stop fighting against itself. The moment you commit to no more forced pushing, you remove the single biggest obstacle standing between your body and any chance of natural relief. The swelling begins to reduce, the rectal muscles begin to relax, and the tissue that has been under sustained pressure finally gets a brief window to recover. Now the work begins. The second step is strategic hydration. Not a large glass of water all at once, because a sudden flood of fluid into a stressed digestive system can trigger nausea and cramping. Small, consistent sips. Warm water where possible, because warmth promotes muscular relaxation along the entire digestive tract. Research published in the European Journal of Gastroenterology confirmed that adequate hydration directly increases stool water content, reducing friction between hardened stool and the rectal wall. You are not drinking to feel better. You are drinking to chemically soften the blockage from the inside. The third step is correct suppository use. Glycerin suppositories are one of the most effective and safest first-line interventions for fecal impaction that has not yet reached the point of requiring emergency care. Here is how they work. Glycerin draws water directly into the hardened stool through osmotic pressure, while simultaneously lubricating the rectal wall to reduce friction during passage. A 2019 clinical review in the American Journal of Gastroenterology confirmed glycerin suppositories as a recommended first-line home intervention for rectal impaction in adults. The positioning matters as much as the suppository itself. Lie on your left side with your knees drawn toward your chest after insertion. This position, called the left lateral decubitus position, aligns the rectum with the natural gravitational pull of the sigmoid colon above it, allowing the suppository to remain in contact with the hardened stool long enough to work. Give it a minimum of 15 to 20 minutes before attempting any bowel movement. Rushing this step wastes the intervention entirely. The fourth step is full body relaxation. A warm bath, not hot, warm, does something no medication can replicate in this moment. It activates the parasympathetic nervous system, the same system that governs healthy, spontaneous bowel function. Stress and tension suppress that system completely. Warmth restores it. Spend 15 minutes in a warm bath after the suppository has had time to work. Deep, slow breathing while in the water accelerates the relaxation response and reduces the pelvic floor tension that has been building for days. The fifth step is gentle movement. Once out of the bath, walk, slowly, calmly, but continuously for at least 10 minutes. Walking stimulates peristalsis, the rhythmic muscular contractions that move waste through the digestive system, through gravitational pressure and abdominal muscle engagement. Studies in gastroenterology consistently show that even moderate physical movement significantly accelerates colonic transit in constipated patients. But there are moments when none of this is the right answer anymore. If you are experiencing severe abdominal pain that does not ease between attempts, stop. If you notice blood, either in the toilet or on tissue, stop. If vomiting has begun, stop. If fever has developed alongside your digestive symptoms, stop everything and seek emergency care immediately. These are not symptoms to monitor at home. These are the body's final warning signals before the situation moves beyond what any home intervention can safely address. You now have a plan, a real, medically grounded sequence of actions that gives your body the best possible chance of resolving this without further escalation. But if those steps don't move things, or if you are already past that window, then you need to know exactly what happens when you walk through those emergency room doors. Because what doctors do next is not what most people expect. Walking into an emergency room for this feels humiliating to most people. It shouldn't. And by the time you finish this video, it won't. Emergency physicians and gastroenterology teams see fecal impaction with a frequency that would genuinely surprise you. It is not an unusual presentation. It is not something that raises eyebrows in a clinical setting. It is a documented, well-understood medical condition with a clear, established treatment pathway. The embarrassment you are carrying through those doors is entirely yours. The medical team left that judgment at the entrance long before you arrived. Here is exactly what happens when you get there. The first thing a physician does is assess the abdomen manually. They press along the lower quadrants, feeling for distension, rigidity, and the location of the impacted mass. This gives them immediate information about severity and position without any imaging. In straightforward cases, this physical examination alone is enough to confirm the diagnosis and begin treatment. In more complex presentations, imaging is ordered. An abdominal X-ray identifies the precise location and volume of the impaction, while a CT scan provides a more detailed picture of the surrounding tissue, specifically checking for any signs of perforation, inflammation, or compromised blood flow. A 2020 clinical guideline published by the American College of Gastroenterology identified CT imaging as the gold standard for evaluating severe or complicated fecal impaction cases. Treatment begins with enema administration. A phosphate or mineral oil enema is introduced directly into the rectum to soften the hardened mass and lubricate the surrounding walls. In many cases, this intervention alone, combined with the softening work already done by any suppositories used at home, is sufficient to initiate clearance. The relief patients describe after successful enema treatment is immediate and profound. Pressure that has been building for days releases within minutes. In severe cases where the impaction is too large or too hardened for enema treatment alone, manual disimpaction is performed. This procedure is conducted under sedation, because relaxation of the pelvic floor muscles is essential for safe extraction, and because patient comfort during the procedure is a clinical priority, not an afterthought. Anesthesia removes the involuntary muscular resistance that would otherwise make the procedure both ineffective and potentially injurious. The moment clearance is achieved, patients consistently describe the same thing. The pressure disappears, the nausea lifts. Breathing feels easier, the abdomen softens. And for the first time in days, sometimes longer, the body finally feels like it belongs to them again. That relief is real, and it is waiting on the other side of the decision to get help. Now, let's make sure you never have to make that trip again. That relief you just heard about, The pressure gone, the body finally calm, sleep returning, appetite coming back. That is not just the end of a medical emergency. That is your body showing you exactly what it feels like to function the way it was designed to. The question now is how to protect that. Because fecal impaction does not happen randomly. It builds, quietly, gradually, over weeks and months of small daily habits that seem harmless individually, but compound into something serious over time. And the good news is that the same way those habits built this problem, new habits can permanently prevent it. The first and most powerful intervention is hydration, not occasional water, consistent, daily, deliberate fluid intake. The colon draws water from stool continuously. That process never stops. Giving your body adequate fluid every single day is the most direct way to ensure stool never hardens to the point of becoming immovable. Research published in the European Journal of Nutrition found that increasing daily water intake by just 1 to 1.5 liters significantly improved stool consistency and bowel frequency in chronically constipated adults. The second intervention is movement. A daily walk, even 20 minutes, stimulates peristaltic activity throughout the entire digestive tract. The gut responds to physical motion in ways no supplement can fully replicate. Consistent movement keeps the digestive system rhythmic, predictable, and self-regulating. The third intervention is fiber balance. Not maximum fiber, balanced fiber. Too little fiber produces hard, slow-moving stool. But too much insoluble fiber without adequate hydration creates a different kind of blockage entirely. The goal is moderate, consistent fiber intake from whole food sources, paired always with sufficient water. The fourth intervention is never ignoring the urge. When your body sends the signal, respond to it. Every time that urge is suppressed, stool sits longer, hardens further, and makes the next attempt more difficult. Respecting that signal consistently is one of the simplest and most protective digestive habits you can build. And finally, listen earlier next time. The body whispered before it screamed. It always does. The discomfort, the fullness, the failed attempts in their early stages, those were the moments to act, not days later when the situation had compounded into an emergency. You now have everything you need: the knowledge, the warning signs, the action plan, and the prevention tools to make sure this never reaches that point again. Don't suffer in silence. Don't wait. And don't let embarrassment make a medical decision for you. Thanks for watching all the way through. Staying informed is key to living a healthier, longer life. If you want more simple, practical health advice, make sure you subscribe and tap the next video on your screen. And before you go, leave a comment and rate this from 1 to 10. Your feedback helps me create better guidance for you.